I think the thing that you've got to keep in mind when you're an adult is that that kind of thought process likely isn't going to be conscious in childhood. Like, or it's not going to be as sophisticated as you and or a therapist are going to define it to be in adulthood. One of the things that happens in adulthood that's tricky is if we have certain like traumas or adversities that we go through, sometimes going back into childhood and trying to talk about it in therapy is a very difficult endeavor because we don't have the ability to actually go back and hear our thought process. I mean, the important thing to remember developmentally is that when we are growing up as kids, we are very egocentric, and we tend to filter the things that happen to us in a way that we're going to see as being our fault in some way or another. What kind of meaning we make out of that is generally not going to be as sophisticated as we think that it was when we're adults. And it's very important to remember that. So how you search for that sort of childhood thought process is going to be through the process of talking about it in therapy and maybe doing some reflecting on your own in terms of like, when I was in these moments and I wasn't eating or whatever, what was I thinking or what can I recall to the best of my ability? But it's not a science. Like, that's not an exact thing that is the same for every single person. Some people try to think about childhood narratives and try to think about stuff like that and have a very hard time ever coming up with anything and have to accept that they just don't know and that they have to decide what they're going to do now as an adult. Other people have a little bit more of an ability to find that, make meaning out of it. But the thing to remember is that no matter what, whether you go back to your childhood or whether you don't go back to your childhood, ultimately people generally talk about stuff in therapy because it's affecting them now. So it's sometimes important to consider, even if I did figure out what this is, or even if I didn't, what's the thing that this would lead to? What's the change that this would lead me to want to employ in my life? And sometimes we don't even have to go back to childhood in order to start implementing those changes. But it really depends. As far as books and stuff, if you're talking to a therapist about it already, ask them. Bibliotherapy is not a strong suit of mine, particularly when it comes to eating stuff.